All right, we'll go ahead and get started. Today's June 15th, 2021. This is the Makah EOC public briefing. We'll go ahead and get started with Dr. Cope if you're ready.
Yes, good morning, everyone. Thank you, Chief Bruner. I'm happy to be here with all of you again. Just sharing my screen and getting the presentation pulled up. All right, so I'm again very happy and thankful to report that we still have no active cases in Nia Bay, and this is since April. We have had 13 cases total during this pandemic, all recovered at this point, although certainly there's some long-lasting, um, what they call long haulers syndrome or COVID impacts on some of our patients' lungs, but thankfully all of them are stable and continuing to recover. And at this time, we have 0 individuals in official quarantine. Clallam County, many of you may have seen in the news, has had 2 new outbreaks in the last 2 weeks, one of which I reported on last week had to do with a long-term care facility. In that case, COVID was brought in by an unvaccinated visitor to a patient. And unfortunately, even though many of the residents were vaccinated, several still got the virus due to what we know, which is that older adults with compromised immune systems or just older immune systems, sometimes the vaccine doesn't work as well. So that is one of the sources of the outbreaks, and the other is tied to a church. So we know for sure that indoor gatherings are without masks and without physical distancing are high risk for spreading COVID. And in this case with the church, I believe most of the individuals were not vaccinated. So strongly recommend continuing to wear masks, especially in indoor settings, in any of those congregate indoor events. So as a result of that, they have 53 active cases. Still just 2 hospitalizations. There were 3 for a while, and one is clearly been released from the hospital, and there have been no new fatalities, which is great. This data has not been updated to reflect what we know about the spike, so you can see where they're anticipating, Washington State DOH is anticipating this graph's going to go up. So it is, although it says 46.9, that's where we were at before the last outbreaks. So now we're at about 72 in Clallam County, and that's 72 cases per 100,000. Washington State is continuing to have overall a decline in the rate of cases. And then just a weekly report on the variants of concern. I'm still trying to get as much of a grasp as I can on the World Health Organization's new naming system for the variants, but I want everyone on this call to know that the B117 is now being referred to as alpha. And then there is on the next slide, I'll show you the Delta variant, which is the one coming out of India, is a variant of interest at this time, but is anticipated to become the most dominant strain. And I'll hopefully have more information on this and the nomenclature for next week's public EOC briefing. New data that was just released on June 11th, on Friday, is that it is very clear, evidence-wise, using all of the statistics and epidemiology, and looking at the data from our very first COVID vaccines all the way to May 1st, that the correlation of more people getting vaccinated is directly related to the decrease in new cases and deaths from COVID. So there's clear evidence that what we're experiencing now in terms of a decrease is related to the number of people getting vaccinated. So I just want to emphasize that the vaccination is how we are going to get out of this pandemic and resume our highly valued and desired social interactions with others. So on that note, we have the COVID vaccines available at STIC and are very eager to help, and we'll talk to anyone who's interested in getting vaccinated or has questions or is just ready. We've got Moderna and Johnson & Johnson for anyone 18 and up. and we've got Pfizer for anyone 12 and up. If this schedule doesn't work for you for the Pfizer or for your family member or your friend who's interested, we will work around it, and we'll do anything we can to get the vaccine to the person so we can protect our individuals and protect our community. Along with that, Washington State is announced this last week, but they are still doing their incentive program. And we have double checked and made sure all of our vaccines are getting into the Washington Immunization Information System. We are also working on purchasing more prizes for adults. There are some limitations on the funds that STIC gets related to COVID, but we're figuring out how to continue to incentivize that. I'm not able to report on the data about the vaccines this week. I'm supposed to get it by tomorrow, so I can report an update on the percentage. And I just didn't want to report inaccurate data at this time, since we know we got a number of, especially youth, vaccinated on Thursday last week. So I'll have those numbers by the end of the day on Wednesday, and hopefully released by Thursday or Friday. But otherwise, that's it.
All right. Well, thank you, Dr. Cope. Appreciate that update and all the good information. So we'll go into, we have no updates from the Makah tribe for today. The Makah EOC, we are going to move these public briefings to every 2 weeks starting next week. So we'll have a gap next week, and then on the 29th, we'll resume again for our normal bi-weekly meetings for the EOC briefing. As far as updates for the Makah EOC, just please continue to check the stick.org website. Continue wearing your masks until that changes. Hand sanitize, and take care of yourself. We'll also, the distribution will be early July, right around the 4th. We will get that date nailed down by the 29th and put it out on that day. So as for right now, I don't see any messages, any questions or anything. We will go ahead and keep moving forward. Thank you guys for attending. Please let everybody know your appreciation, Makah EOC STIC staff, also the Makah Tribal Council. Thank you guys and appreciate everything you do. Keep it up. Have a good week.